Hey everyone, and welcome to another session in our rapid response training series. Today's session is called, what counts as a change? And it's again another common question we hear from services because sometimes a change can be quite difficult to determine and define. So there are certainly times where it's very clear, if a story leads to new equipment or a policy is updated or a process is redesigned. But what about when a story is discussed at a staff meeting or when staff are reminded of existing processes or say, for example, there's additional training that's introduced as a result of the feedback? Do these things count as changes? So today we're going to be looking at what we mean by a change on care opinion and why it's important to record it. And of course, as well, how changes can be identified and communicated. Fabulous. So, yeah, as I said, we're going to be exploring why marking stories with a change is important, why you should be doing it, and it's really valuable just by adding that change flag. And of course, we'll also be looking at, what counts as a change and a change example for each criticality and a bit of a chat about that. But yeah, I did want to start off by showing you these two responses we had really recently, and just asking if you would mark either of these comments as planning or making a change. So I'll let you have a look at them briefly and have a bit of a think, and we can come back to these in the discussion. But yeah, the first is, sort of saying that, we've shared feedback with the management team, and the other ones saying, I've passed on your comments to Kate as well. Do these count as changes? So have a think what immediately comes to mind. Um, but yeah, I'll pop into this now. Why bother making marking a response with a change flag in the first place and making that story come up as having made a change? So there are a couple of reasons. So the first is, of course, for the author. So when someone shares their experience, they're often hoping it will make a difference for the next person. We do have research on this as well. It's from the UK, but they looked at why patients sort of give feedback in the first place, and a lot of it is about wanting to improve care for the next person, and they talk about how we care for healthcare and caring for care. So that's quite interesting. But yeah, by marking a story as having led to a change, we really do close that loop. So we're showing the author that their story didn't just get read, but it also influenced something within the service. So if we look at the care opinion story journey as well on the website, which I've got the screen snips on that page, you'll notice that change planned and change made are those final stages. So it goes response in the purple, and then in the green is when the change been made. So in many ways, they're subtly shown as that natural conclusion of the feedback journey as well. So, someone shares their experience, and where appropriate, that story contributes to improvement. Yeah, so the second reason as well, and as the moderation and reporting officer, these are definitely something that's one of my favorites. So is track and reporting on improvement. So marking a story as having led to a change creates data that can then be reported at ward, service, regional, or even organisational level. So it means you can include these changes in dashboards as well, and it really helps demonstrate the value of listening quite visually, which is quite great. And speaking of visually, we of course have this widget. Now, the image on the screen isn't the change made widget. I just couldn't grab that one in time. But we do have a widget that you can put on your website or intranet or, staff portal, patient portal. And it can be, this one says, recent stories about East Metro, but it can be your service, and it can say, recent changes planned or made in your service. So you can actually display all the stories that have a response with a change planned or change made, which would be really powerful to see. It's a great way of showing that you're partnering with consumers, and It's also a little bit, I know there was that campaign that, still goes, but that, you said we did campaign that was, yeah, quite popular. And this is essentially a live, a updated version of that you said we did continuously, which is really great. But what actually counts as a change? So this slide is actually from Care Opinion UK, so one of their presentations, and I thought I'd include it because, as you can see, it's actually quite broad. So a change should affect, the service of future patients. It can be big or small. It can be something that's planned for the future or done immediately, and of course, it might involve updating staff training. But I wanted to show you this because I actually think it's quite helpful that the definition is quite broad. And I'll go into why towards the end. Actually, hang on, I might pop back here because, yeah, I just wanted to talk about I thought that might have been on the next slide, but why is it quite broad? Because we know that you're the experts of your practice. So Alex, I can see you've already popped something in the chat there that we'll get to in the discussion, which will be great. And at the end of the day, the service knows, what a change looks like for them. And so we don't want to be, Care Opinion coming through and saying, no, this isn't a change, or, no, we don't count that. We want it to be decided by the service themselves. So my job today is really just to inspire you with what changes other services have marked from their stories. You can see what other people are doing, but in no way do I want to restrict you or, paint these as if it's a rule or something like that. So yeah, the first sort of example, if you will, is a really broad category. It's around that sort of environmental or equipment changes. So, these changes are quite common, but they're a bit less complicated to make. And, they're often some of the easiest changes to identify because they relate to something physical. So, environmental signage or parking, something really tangible. But it's a good example because in this story that's on the screen, about the signage, you can see in the response that the change hasn't happened yet, but that's okay because we can, mark it with that we are preparing to make a change. So of course you can get a response out there quite quickly saying, we're planning on making this happening. And then once the signage has been updated, the service can, post a change made response. So it's a really simple change, but one that could improve the experience of every future patient as well. Thinking back to a recent response I had, there was for another service a story that it was about increasing the signage in a department and an award, and the response was that they'll pass it on to the department to have a discuss. And I thought, oh, what a missed opportunity to make such a simple change that you can then report on and show your consumers. Because yeah, I do think sometimes, I mean, correct me if I'm wrong, but signage is one of the easiest changes we can make when it comes to patient feedback. Another one's equipment, which isn't as easy. But yeah, I've got a great response here. The change hasn't happened yet, but they're going to be reviewing the suggestion and considering what would be required to introduce birth slings into the department. And that's exactly what Change Plan is for. So of course, we do recognize that not every change can be made instantly. That's certainly not what Care Opinion is for. It's all about how stories can inform change, even if that's in the planning area. But yeah, I'll move on to not really a theme, but I thought as well, we can cover that environmental and equipment because that's quite broad, comes through quite a lot in Care Opinion. But I also just wanted to show you through each of the criticalities as well to show you that any criticality story you can get may, be able to have a change planned or made in it. So I just want to show you some examples. even a crit 0, and you can be thinking, how is that possible? Because it's a crit 0. But if you go back to the UK slide, even they say that crit 0 stories can have a change made. I always tell people use Care Opinion as this public forum to talk about all the great work you're doing, which is exactly what this response from Chloe has done. So in the story, the author shares really positive feedback about the MPAS clinic at Swan Hill, so a new maternity clinic. And, it explains about the continuity of care that they received, similar to, I'm sure, MGP and other services like that. But yeah, Chloe then uses a response to explain that the clinic itself was introduced in response to a gap. So even though this story necessarily didn't result as a change, you can still say that a change was made as a result of feedback, and you can mark it as made a change, whatever you feel fits your health service the best. So yeah, as you can see here, the service recognized that need, and they developed the clinic and has since, supported more women than originally expected. So yeah, even though this is a positive story, it can still be marked as a change made because the story is showing the impact of a service improvement. And again, yeah, it's in the UK slide. So yeah, often don't think positive stories can result in a change, but if that's something you want to display for your health service, you absolutely can. And I would recommend it because it does mean that, years down the track, if you want a way of really easily tracking changes as a result of feedback, you can, yeah, find them very easily. Now a crit 1 story. So in this example, the author is very complimentary of the emergency department staff, but the situation that, they had been in. So I think it was, a major BMX event was taking place in town. It resulted in several injured riders, as you can imagine. And they presented to the ED, but they didn't believe that the ED was prepared for this event. And you can see I love this response so much. I think it's really transparent. Jeremy's really discussed, what happened, the investigation he had a look into, the reviewal of, this notification process as well, and, spoke with staff, contacted the BMX club directly. So really great transparent response. And of course, that's absolutely a change made. So, yeah, crit ones are quite a good one to get a change made as well for. Now, yeah, in crit 2, you'll often find that these stories sort of relate to interpersonal aspects of care, and so do sort of crit 3 and 4 and 5. They sort of move into that personal, experience of care that, can be a bit trickier to make to make a change about. So in this example, the author explained that during their child's 12-month check, they weren't asked for consent when the nurse examined their child's body. And so, of course, they understood this formed part of the assessment, but they just felt it should have been a bit explained beforehand. So the response is really great. The servers actually reviewed the concern, confirmed that obtaining consent is standard practice, and then they have also advised that all members of the team would be reminded of the importance of this consent. So yeah, it was marked as, change made, and it's also, yeah, a really good example of how a reminder to staff or a reinforcement of an existing process can still be a meaningful change, which is, again in that UK slide. So yeah, don't be afraid to mark stories with a change planned or change made. I know sometimes people can be a bit worried about it, thinking it's overshooting themselves, but it's absolutely not. Don't be afraid of doing it. A crit 3 story as well. As I said, changes in this criticality become more, comprehensive. The issues being raised are more serious and usually require a more formal review. So in this story, the author's spouse described delays in responding to call bells, and more than that. But sort of a lack of general attention that they felt. But the response came through, and it's a change made. They investigated the concerns, so they were actually fortunate also to be able to discuss with the patient and family, which does help. But yeah, they reinforce the importance of responding promptly to call bells, and marked, the story as a change made because the concerns resulted in a clear improvement plan that was communicated publicly. And as you can see, the author was really quite happy with that as well. So you can actually see the full feedback loop happening in this story, which is really good. But it's a great example of how, don't, as soon as you see a crit 3, don't think that changes can't arise from it. Of course, it makes it quite easy, or not easy, I should say, but it really does help when patients do get in contact, and you're able to resolve their concerns offline. And when that happens, jump on and talk about it in your response. Now, I thought we'll go crit 4 and 5 is the same. This story is actually a crit 5, but you could absolutely do the same with a criticality 4, but it can result in a change being made, even a crit 5 story. So in this case, the author described being advised to terminate what was later confirmed to be a healthy pregnancy after they went to a second hospital and received a second opinion. So already we know this is a really serious story, but we've got 2 really great responses here from Karen. So initially, Karen responded, by apologizing, inviting the author to meet with the obstetric team. And then following that meeting, Karen could have left the response there, but she's actually posted another follow-up response, change made, focused on improving communication with patients, strengthening the supervision of registrars, and really ensuring that serious complications and alternative diagnosis are discussed more effectively in the future. So a really great example, because the change isn't just a new building or a new piece of equipment. It's instead about improving the way that care is delivered. And a lot of times these changes, it doesn't have to be a change made necessarily for others. It can just be a change made for that patient, for that individual. Did you meet with them and solve their concerns? Absolutely, you've made a change if that's the case. Which also brings me to my next point, the importance of marking a change planned to a change made. You can, a lot of you probably will have set up alerts where after 4 weeks, if it's a change planned, it can get changed into a change made, and we do send an email to remind everyone. But you can also change the time frame that these emails come in. Maybe you want to get notified after 8 weeks or 12 weeks. But yeah, I would recommend even maybe keeping track of any stories you've got that are a change planned, and have a think about just keeping a note of them for when you can update it to a change made. It looks really good to the community who it's really also great for accreditation and partnering with consumers. You can, the system tracks it all, so just make use of that. Yeah, really wonderful. And I also know that, government systems report on it as well. So fabulous. Um, I do have an example of that as well from Cameron Ross. So just to show you that full feedback journey, I know we sort of saw it in Karen as well, but I love that in Cameron's second response, he's gone, I wish to provide you with an update. And you can just, that's exactly what it is. It's just this update, this open, transparent communication, that you're not just telling the patient, but you're just telling everyone that reads this story, everyone that wants to know about the health service. And it's got a great little green tick. So this transparency is really valuable. It does show that the story followed, through, and it closed the loop, and it made that outcome really visible to everyone. So I often say that if it happens behind closed doors, it's missing half that value. So yeah, make sure you talk about it. So to summarize from the stories today, some idea of what changes can arise out of each criticality. So, we did start with those broad environmental changes, but then, narrowed into those formal reviews and personalized changes. So with criticality 3, I've also married them a little bit into crits 4s and 5s, because while they are a little bit rarer to make a change from, I don't believe they're always necessarily harder to make a change from, but they're on that same level of that individual personalized response that we probably do need to sometimes meet with the patient for. But we also do have crit 4 changes that have arisen even without the patient being met with. So to finish off, I want to leave you with a few questions to ask yourself whenever you're deciding to mark a story as having, led to a change, and whether you're a bit unsure and having a bit of a think about it. So, you can ask yourself, has something been done differently? Has something been introduced or changed? Has it prompted a review or a discussion, or have staff changed or reinforced their practice? Also, will it improve care for future patients? So it's really important to think of, these questions and remember that you are the expert in your own service. So Care Opinion deliberately keeps the definition of change broad because of that reason. If you can answer yes to one or more of these questions, it's worth considering adding a change flag to your story. Have a think about, have I changed the care for this patient or for any future patient? Has this story impacted in any way that I want to mark for my service? And really, I don't want you to underestimate the value of small changes. So whether it's a reminder to staff or a review of just a process or a significant service improvement, if a story has helped make care better for future patients or even for that patient, it's really worth a change worth recognizing.